Chapter 7, Pre-Examination, Pre-Analytical Complications. Chapter Objectives. Upon completion of Chapter 7, the learner should be able to do the following. 1. Describe pre-analytical, pre-examination complications related to blood collection, procedures, and effect on patient safety. 2. Explain how to prevent and/or handle complications in blood collection. 3. List at least 5 factors about a patient's physical disposition, i.e., makeup, that can affect blood collection. 4. List examples of substances that can interfere in clinical testing of blood analytes and describe methods used to prevent these interferences. 5. Describe how allergies, a mastectomy, edema, and thrombosis can affect blood collection. 6. List pre-analytical complications that can arise with test requests and identifications. 7. Describe complications associated with tourniquet pressure and fist pumping. 8. Identify how the pre-analytical factors of syncope, petechiae, neurological complications, hemoconcentration, hemolysis, and intravenous therapy affect blood collection. 9. Describe methods used to prevent these interferences. Overview. Pre-analytical or pre-examination variables that are important to healthcare workers involved with blood collection are shown in box 7.1. The value of laboratory responsibilities to patient-centered care and safety is becoming increasingly apparent, especially as new laboratory testing becomes available, i.e. complex genetic and cancer marker tests. As mentioned in other chapters, pre-analytical variables are particularly critical to healthcare workers because most of them can be controlled. Often when a blood collection error occurs, it could have been prevented by taking precautions, such as proper ID check of patient. Occasionally, however, patient complications during or after blood collection procedures are unavoidable. If so, the healthcare worker must be knowledgeable about methods that will decrease the negative impact of the complication to the patient, to the quality of the blood sample, to the healthcare worker, or to all three. This chapter covers patient complications and the pre-analytical variables that are reported most often. Box 7.1, variables important in specimen collection, patient assessment and physical disposition, test requests, specimen collection, specimen transport, and specimen receipt in the laboratory. Categories of pre-analytical variables. Blood specimens used to determine the amount of the patient's glucose, cholesterol, triglycerides, electrolytes, proteins, and so on should be collected when the patient is in a basal state. That is, in the early morning, approximately 12 hours after food intake. The results of laboratory tests on basal state specimens are most constant. However, several factors including diet, exercise, emotional stress, obesity, menstrual cycle, pregnancy, diurnal variations, posture, tourniquet application, and chemical constituents, alcohol or drugs, can cause changes in the basal state. Healthcare workers need to have a general understanding of these possible patient changes and their effects on laboratory testing. Diet. To ensure that the patient is in the basal state, the physician must require the patient to fast overnight. The term fasting refers to no food or drinks except water. The required time period necessary for fasting depends on the test procedures to be performed. Before collecting a specimen, the healthcare worker should ask the patient whether he or she had anything to eat or drink. The amounts of blood analytes significantly change after meals and thus are not correct for many clinical chemistry tests. If the patient has eaten or had anything other than water to drink recently, but the physician still needs to test, the word non-fasting must be written on the requisition and/or directly on the specimen. When giving instructions to the patient to fast for blood tests, it is important to gain the patient's cooperation by using professional behavior. Inadequate patient instructions can cause mistakes in specimen collection. Casual instructions are apt to be taken lightly by the patient or even forgotten. If asked to explain fasting restrictions to a patient, the instructions should be thorough and clear, with emphasis on the important points of the procedure. Some patients assume that the term fasting refers to abstaining from or avoiding food and water. Abstaining from water can result in dehydration, which can cause errors in test results. Thus, the healthcare worker must ensure that the patient understands all the requirements written all the requirements. Written instructions are also helpful if available. If a procedure involves some discomfort or inconvenience, the patient should be informed. For example, if blood is to be collected for timed blood glucose levels, cholesterol levels, and/or triglyceride levels, the patient needs to fast for 8 to 12 hours. The healthcare worker can inform the patient that several specimens will be collected at time intervals and that he or she may drink water, but that coffee, tea, and chewing gum should be avoided because they may cause an error in lab studies or lab results. Obesity. More than 60% of adult patients in the United States are overweight. Obese patients generally have veins that are difficult to visualize and/or palpate. Refer to Chapter 8 to view examples of different arm veins. If the vein is not entered when first punctured, the healthcare worker must be careful not to probe, i.e. dig, excessively with the needle, because doing so destroys red blood cells and causes errors in blood test results. Usually the patient, him or herself, knows where the best site is for the venipuncture, so it is helpful to check with the patient before selecting the site. Also, there are longer needles available for collections from obese patients. Damaged, sclerosed, or obstructed veins. Obstructed or clogged veins do not allow blood to flow through them. Sclerosed or hardened veins are a result of inflammation and disease. Patients' veins that have been repeatedly punctured often become scarred and feel hard when the arm is palpated to find a venipuncture site. Because blood is not easily collected from these sites, they should be avoided. Chapter 8 discusses alternative venipuncture sites. Allergies. Some patients are allergic to iodine, alcohol, or other solutions used to cleanse a puncture site. Check for color-coded armbands or posted signs indicating specific patient allergies. Also, another precaution is to ask the patient if he or she is allergic to a solution or latex. If a patient states that he or she is allergic to a solution, all efforts should be made to use another cleansing agent. Chlorhexidine has been reportedly used as an alternative to cleanse the skin. After application, it can be wiped off with sterile water. In addition, some patients are allergic to latex. Latex-free tourniquets, gloves, and bandages must be used for patients who have this allergy. See Chapter 4 for more information about latex allergy. Mastectomy. Patients who have undergone a mastectomy, i.e. surgical removal of the breast, often have resulting lymphedema, increased lymph fluid, on the site of the surgery. The fluid in the area may make the patient more prone to infections. Therefore, the arm and area around the arm on the side of the mastectomy should be protected from cuts, scratches, burns, and blood collection. Edema. Some patients develop edema, i.e. an abnormal accumulation of fluid in the tissues, because of reasons other than mastectomy, such as heart failure, renal failure, inflammation, malnutrition, and bacterial toxins. This swelling can be localized or spread over a large area of the body. The healthcare workers should avoid collecting blood from these sites, because veins in these areas are difficult to palpate or locate, and the specimen may become contaminated with fluid. Again, consultation with the physician is sometimes needed to determine whether and where a blood specimen should be taken. Clinical alert. Venipuncture and/or skin puncture should never be performed on the same site as that of a mastectomy unless written approval by the physician is obtained, because the patient is more susceptible to infection, and some analytes in the blood may be altered. Also, the pressure from the tourniquet could lead to injuries in a patient who has this type of surgery. If the patient has had a double mastectomy, fingertips are better sites for blood collection. However, the physician should provide written permission for this blood collection to occur. Thrombosis. Thrombi are solid masses derived from blood constituents that reside in the blood vessels. A thrombus may partially or fully close a vein or artery, and such occlusion will make venipuncture more difficult. Clinical alert. Burned, scarred, or tattooed areas. Areas that have been burned, scarred, or tattooed should be avoided during phlebotomy. Burned areas are very sensitive and susceptible to infection, and veins under scarred areas are difficult to palpate. Collecting specimens from these sites can be very painful. Tattoos contain dyes that may interfere with laboratory tests. Also, tattooed areas are susceptible to infections and impaired circulation. Vomiting. Sometimes the thought or sight of blood before or during blood collection leads to nausea and possibly vomiting. If this reaction occurs, have the patient take deep breaths and use a cold compress on his or her head. Following the healthcare facility's protocol, also contact the phlebotomy supervisor and the patient's physician about this complication. Complications associated with test requests and identification. Identification discrepancies. Improper identification is the most dangerous and costly error a healthcare worker can make. Because it can be life-threatening, identification should include a match between the patient's identification, his or her verbal confirmation, and the test requisition. At least 2 patient identifiers are necessary to avoid an identification error. Bed labels, water pitchers, or door charts should not be used as a patient identifier. Even armbands are not completely reliable. Refer to Chapter 8 for more details on identification procedures. Sometimes a phlebotomist is the first to detect a discrepancy between a name on a requisition and a name that the patient states, or the name on the armband. In these cases, the discrepancy should be reported to a supervisor and/or nurse and may result in the prevention of other errors related to that patient. These discrepancies must be resolved before collection of any samples. Time of collection. Time and factors can affect test results. In some cases, such as testing drug levels, the timing of the collection must coincide with when the dosage was given. Early morning specimens are most commonly requested in hospital settings because a fasting specimen is preferred, given that reference ranges are based on fasting specimens. If a healthcare worker is running late, the specimen might be collected after an inpatient has eaten breakfast and would require special notation about his or her non-fasting condition. Requisitions. Checking the requisitions to match the laboratory test request and the appropriate type of collection tube is essential to minimize the amount of blood collection from each patient. Too much blood loss because of excessive specimen removal can result in anemia. Complications associated with the specimen collection procedure. Tourniquet pressure and fist pumping. Laboratory test results can be falsely elevated or decreased if the tourniquet pressure is too tight or is maintained for too long. The pressure from the tourniquet causes biological analytes to leak from the tissue cells into the blood or vice versa. For example, plasma, cholesterol, iron, lipid, protein, and potassium levels will be falsely elevated if the tourniquet pressure is too tight or prolonged. These falsely elevated results may be seen with a short as a 3-minute application of the tourniquet. The recommended time for tourniquet application is no longer than 1 minute at a time. In addition, some enzyme levels can be falsely elevated or decreased because of tourniquet pressure that is too tight or prolonged. Also, pumping of the fist before venipuncture should be avoided because it leads to an increase in plasma, potassium, lactate, and phosphate concentrations. Reducing recollections for blood. Several factors may cause the healthcare worker to miss the vein. These factors include not inserting the needle deep enough, inserting the needle all the way through the vein, holding the needle bevel against the vein wall, or losing a vacuum in the tube, as demonstrated in Figure 7.1. During needle insertion, the glove index finger can be used to help locate the vein. The needle may need to be moved or withdrawn somewhat and redirected. The only acceptable redirections are backward and forward in a relatively straight line. In an elderly geriatric patient, the vein may be tough during needle entry, and it may roll. Such rolling can cause the needle to slip to the side of the vein instead of properly puncturing it. Thus, the healthcare worker must securely anchor the vein before blood collection to prevent rolling. If the vein rolls, it is the fault of the blood collector because the anchoring technique used on the vein was not sufficient. Do not blame the patient. On occasion, a blood collection vacuum tube will have lost some of its vacuum and the blood slowly trickles into the collection tube, or the tube may have no vacuum because of a manufacturer's error, the age of the tube, or tube leakage after a puncture. Therefore, an extra set of tubes should be readily available to change to another tube in case this should happen during venipuncture. Also, needles for evacuated tube systems have been known If this happens, the tourniquet should be released immediately and the needle removed from the arm as the safety device is activated over the needle to avoid needle stick to blood collector. Feigning or syncope. Syncope is the sudden loss of consciousness caused by a lack of oxygen to the brain that results in an inability to stay in an upright position. Patients usually recover their orientation quickly, but injuries, such as abrasions and cuts, often result from falling to the ground. Syncope may be caused by a variety of things, including low blood glucose levels, heart ailments, rapid breathing, mental conditions, or medications. Many patients become dizzy and faint, get weak in the knees at the thought or sight of blood. Also, patients who have donated blood recently and/or fasting patients frequently become faint. Therefore, the healthcare worker should be aware of the patient's condition throughout the collection procedure. This can be done by asking ambulatory patients whether they tend to faint or have ever previously fainted during blood collections. Also, look for signs of fainting such as sweating, paleness in the face, anxiety, hyperventilation, and nausea. If so, they should be moved from a seated position to a lying position. Even for an ambulatory patient without a history of fainting, it is still extremely important to use blood collection chair with a locked armrest to avoid the possibility of a fall if he or she faints. If you are a home health care provider, you need to have the patient seated in a chair with arm supports or have him or her lie down. A recliner chair with armrest is also a good safe place for blood collection. If a seated patient feels faint, the needles should be removed. The patient's head should be lowered between the legs, and the patient should breathe deeply. If possible, the healthcare worker should ask for help and move the patient to a lying position. Talking to patients can often reassure them and distract their attention from the blood collection procedure. Bedbound patients may also faint during blood collection, although rarely. In any case, the healthcare worker should stay with the patient for at least 15 minutes until he or she recovers or until a nurse or physician takes over. A wet towel gently applied to the forehead or a glass of juice or water may help the patient to feel better. Clinical alert. If a patient faints during or after the procedure, the healthcare worker should try to end the venipuncture procedure immediately and make sure that the patient does not fall or become injured. Sometimes controlling the situation is difficult because of the patient's physical size. However, the healthcare worker should use common sense about the safest position for a patient. If a patient has fainted and is in a secure position, the healthcare worker should quickly request assistance from the nursing staff or physician. A patient who has fainted should recover fully before being allowed to leave and should be instructed not to drive a vehicle for at least 30 minutes. Patients often think too soon that they have recovered, but when they try to stand up, they collapse again, risking injury. An incident report must be filed with the healthcare facility regarding the fainting incident and any injuries resulting from the fall. The immediate precautions taken and what instructions were provided to the patient to prevent the possibility of long-term complications, such as a car accident after the fainting incident. Hematomas. When the area around the puncture site starts to swell, usually blood is leaking into the tissues and causes a hematoma. A hematoma can occur when the needle has gone completely through the vein, the bevel opening is partially in the vein, or not enough pressure is applied to the site after puncture. This swelling results in a large bruise after several days. See Figure 7.2. If a hematoma begins to form, the tourniquet and the needle should be removed immediately, and pressure should be applied to the area for approximately 2 minutes. If the bleeding continues, a nurse should be notified. Petechiae. Petechiae, or small red spots appearing on the patient's skin, indicate the minute amounts of blood have escaped into the outer skin layers. See Figure 7.3. This complication may be the result of a blood clotting abnormality such as thrombocytopenia, that is, a low platelet count, and should be a warning that the patient's puncture site may bleed excessively. Petechiae also occurs during illnesses with fever. Excessive bleeding. Most patients stop bleeding at the venipuncture site within a few minutes. Patients receiving anticoagulant therapy and/or high doses of arthritis medication or other medication, however, may bleed for a longer period. Often elderly patients are receiving these medications and must be watched carefully for excessive bleeding. Also, coagulation abnormalities can cause excessive bleeding. Thus, anytime a venipuncture is performed, pressure must be applied to the venipuncture site until the bleeding stops. Clinical alert. The healthcare worker must not leave the patient until the bleeding stops or a nurse takes over to assess the patient's situation. In rare instances, the healthcare worker may accidentally puncture an artery instead of a vein. An artery has pulsating pressure that causes the blood to squirt out in pulses. These cases require that pressure be applied as quickly as possible to stop the bleeding and that a nurse and/or supervisor be notified as soon as possible. Neurological complication. If the healthcare worker accidentally inserts the needle all the way through the vein, he or she may hit the nerve below the vein. If this happens, the patient will most likely have a sharp electric tingling and painful sensation that radiates down the nerve. The tourniquet should be released immediately, the needle removed, and pressure held over the blood collection site. An incident report on the occurrence should be completed and given to the supervisor. Clinical alert. A rare but serious complication that may occur during blood collection is seizure, a sudden attack, or convulsion. Try to keep the patient from hitting things. If a patient begins to have a seizure, the healthcare worker should immediately release the tourniquet, remove the needle, move the patient to a lying position if they have not fallen already, attempt to hold pressure over the blood collection site, and call for help from the nursing station. No attempt should be made to place anything in the patient's mouth unless the healthcare worker is experienced and authorized to do so. Hemoconcentration. Hemoconcentration, the increase in red blood cells and other cells and solids in the blood, is caused from loss of fluid in the surrounding tissues around the venipuncture site. These may be due to several factors, including prolonged, i.e. longer than 1 minute, tourniquet application, massaging, squeezing, or probing a site, long-term intravenous or IV therapy, and sclerosed or occluded veins. All of these practices and/or sites for venipuncture should be carefully avoided. Intravenous therapy or IV. Every time a catheter IV is used, vein damage occurs. Circulatory blood is rerouted to branching veins and can result in hemoconcentration. As a consequence, patients on IV therapy for extended periods often have veins that are palpable and visible, but damaged or occluded. An arm with the IV line should not be used for venipuncture because the specimen will be diluted with IV fluid. Instead, the other arm or another site should be considered. Alternatively, sometimes the nurse or the physician can disconnect the IV fluid and collect blood from the line that is already inserted. In this situation, the first few milliliters of the specimen should be discarded to remove the IV fluid, and a note should be made on the laboratory requisition that this step was performed. Also, blood collections through an IV device increase the risk of hemolysis since the IV cannula is not designed for blood collection. Hemolysis. Hemolysis results when RBCs are lysed or destroyed. Hemoglobin is released and serum or plasma, which is normally straw-colored, becomes tinged with pink or red. If a specimen is grossly hemolyzed, the serum or plasma appears very dark red. Hemolysis can be caused by improper phlebotomy techniques such as using a needle that is too small, i.e. 25 gauge, expelling the blood vigorously into the tube, shaking or mixing tubes vigorously, performing blood collection before the alcohol has dried in the collection site, or pulling the syringe plunger back too fast, although syringes are not recommended for routine use. Hemolysis may also be the result of physiological abnormalities, such as sickle cell disease, exposure to drugs or toxins, artificial heart valves, and some infections. Hemolysis due to poor technique or sample handling causes falsely increased results for many analytes, including potassium, magnesium, iron, lactate dehydrogenase, phosphorus, ammonia, and total protein. Hemolysis also shows false decreased RBC counts, hemoglobin, and hematocrit. These problems can easily be prevented with appropriate handling. The healthcare worker should document the fact if he or she notices that a specimen is hemolyzed. Collapsed veins. Veins collapse when blood is withdrawn too quickly or forcefully during venipuncture, especially when the blood is being collected from smaller veins. See figure 7.1f. And or the veins of the geriatric patients. Thus, the healthcare worker should use a smaller blood collection tube and or a smaller needle size, such as 23 gauge, during the collection process for patients with smaller veins and or geriatric patients. A collapsed vein should not be probed with a needle. The healthcare worker will notice that the tube is filling properly, but then the blood entering the tube starts to slow and stops flowing. A smaller tube size should be used for the remainder of the blood collections. If the problem is not resolved, then the patient's blood should be recollected using a syringe because the healthcare worker can control the force of vacuum exerted on the vein. Turbid or lipemic serum. After cells have settled or have been separated from the serum or plasma, it is normally clear, light yellow, or straw-colored. Turbid serum or plasma appears cloudy or milky and can be the result of bacterial contamination or high lipid levels in the blood. Turbidity is primarily caused by ingestion of fatty substances such as meat, butter, cream, and cheese. If a patient has recently eaten fatty substances, he or she may have a temporarily elevated lipid level and the serum will appear lipemic or cloudy. Because lipemic serum or plasma does not represent a basal state and may indicate some clinical abnormalities, documentation about the appearance of the serum or plasma may be useful to the physician. Improper collection tube. Learn which common laboratory tests require which collection tubes. However, there are so many possible laboratory tests and tubes available that you should also be familiar with how and where to seek information electronically, via laboratory reference manual, etc. about test and tube requirements that you are unfamiliar with. An example of blood specimen collection in the wrong tube would be as follows. Green top tubes containing lithium heparin are not suitable for a patient's lithium studies because laboratory values will be falsely high, suggesting the patient has a toxic level of lithium when he or she really does not. This concludes Chapter 7.